prostate cancer. It's not an easy topic to discuss. In fact, men altogether avoided talking about it. But that's one of the best ways to, if you talk about it, it helps you get through it. The sooner they can start treating this kid, you become a positive test. And usually, men over 50 is when you should really start looking at it. That's when it usually starts affecting you. And if you do have it, sometimes it can be passed on in your family members. So that's why it's so important to get checked. And if you do have it, it's like I say, it's good to talk to other people. I met a gentleman here in the center. We got to talking, and, we on that subject. We found out, well, I have it, he has it, and we call and talk to each other and network with each other. And then at the yard sale we had, I met another gentleman here, and he started talking, and we started talking again and found out he had it too, and he started feeling better about it. It's a good thing to do.
Come on, man, get those prostate checked, and this is a message for everybody. As we age, we need to stay on top of our appointments. We need to eat better. We need to exercise more. And that goes for everybody, not just the men.
With Care for just tell you a little bit about our organization. What we do is we provide a service that's called structured family care. What that is when you have a family member that's living with someone, they're taking care of that individual. We help that caregiver in a couple of different ways. One, we help them get paid for the work that they're doing, and then we also support them with a clinical team that can assist them. If you've ever had to care for someone, you know that type of thing can fall directly into your lap without any training, right? And be very disruptive of your life. And so we try to make that as smooth of a transition as possible.
I'm representing Kaiser Permanente Senior Advantage. And I want to thank this gentleman right there for your story, sir. Thank you so much. And what we are involved in Kaiser Permanente is preventative care, just like this gentleman right here. Okay? Yes, you go to one spot to get all your treatments done. Yes, we do have specialties that way we can process any sort of cancer. If you need to be seen at a network with Kaiser Permanente, we do have a referral process that you'll be seen with other doctors. Okay? So, all you gotta do to have a Kaiser plan, a Senior Advantage plan, is have Medicare Part A and Part B, and also we do have a plan that incorporates everything together with Medicaid as well.
I represent Centerwell Senior Primary Care, and just like he says at Centerwell, we are a senior focused practice. We only see Medicare and above patients. We focus on cancer prevention, prostate cancer, colonoscopies, all the things that we encourage our seniors to look out for. The benefits of coming to Centerwell is shorter wait times at the doctor. When you come to Centerwell, you're only seeing people that are like you, seniors, and you have a longer time with the physician. We schedule you 45 minutes with the doctor so that you can not only talk about what's going on physically, but physically, mentally, and spiritually, because all that affects each other. So what I would love and invite you guys to do is come out. We're only about 12 miles away from here, right here in Monroe, Georgia, right on Mount Zion. And come see me. We had just added a new doctor, so we have immediate appointments that you can get in to see a doctor, within weeks.
I am an insurance broker, so I represent all the companies from Aetna to Humanity United. And one of the things that I want to leave you with is that you do need to have someone help you review the plans, your Medicare plans. They're all changing. They change every single year. And with the current administration, they're definitely changing. They're getting rid of the grocery cards on the dual plans if you do not have a chronic condition. So you have to attest that you have a chronic condition to get the grocery card. And so it's just great to have somebody to help you and guide you through the system and just understanding Medicaid, Medicare. Everybody gets the two confused. and also understanding what extra help is. So Nordia and I, we both live here in Clayton County. I love coming to the center. I try to come at least twice a month. So if you have any questions about your Medicare plan, I don't even have to switch you. I can just explain to you what's changing on your current plan for the new year. And then I get to work with great people like Centerwell. I send people referrals. If they need a new primary or a new doctor, I'm able to help them with that as well.
I represent the Alzheimer's Association. We have a lot of brochures out there. Now, Alzheimer's and dementia is wreaking havoc in our community. We don't have the resources that they have in other communities, but we do have people like myself that would come and do community education for you. We also have back there 10 warning signs. We don't want to deal with this, but as we age, there are warning signs that we need to take heed to, male, female, and the like. Most of all, healthy brain habits, things that we have to do to keep our brain active, whether it's working out, eating the right things. As we heard before, eating is the main thing, and moving our bodies. So that's one thing that we have to take in mind. Also have a wonderful brochure, Understanding Alzheimer's and Dementia.
I am the owner of Dynamic Dates Event Planning, Decor, and Catering Services. So we pretty much do everything. Been around the Atlanta area since 2015 doing events, and Cheryl asked me to come in today because, believe it or not, I used to be 100 pounds heavier. So in order for me to lose the weight, one of my biggest things is snacks. I love snacking. And trying to find alternative ways to snack healthier. You get tired of fruit, you get tired of vegetables, you want something crunchy every now and again. One of the things I discovered was that chickpeas, garbanzo beans, the other name for them, is a great alternative resource. Are there any vegetarians or vegans in here? Okay, so, there we go. So, hopefully you all are familiar with the power of the chickpea. Chickpea is full of protein, so it's a great meat alternative. Believe it or not, the juice, if you get the kind in a can, the juice from the chickpeas can actually be used as a substitute for egg whites. Yeah, a lot of people don't know that, so you can use it as a substitute for egg whites. The chickpeas can be a chickpea salad, they could be hummus, they could be roasted snacks, it could be a soup, you can make burgers out of it, you can make a chocolate mousse, believe it or not.
Based on a need that I have found in the community. Unfortunately, we have several people who live in rural communities who we have found don't have access to grocery stores. The nearest grocery store may be 20 or 30 miles away. We call those food deserts. And there are multiple food deserts throughout the Atlanta area. Okay? And so based on that, we have started putting together simple recipes that people can do. I mean, when I say quick, like 30 minutes or less, from items you can find at the Dollar Tree. We are going to be making a very simple chili. Okay? And so this chili at a basic level has 5 ingredients. Okay? Now, this has onion powder, garlic powder, so y'all do not stone me because I'm not putting none in this meat. Okay? But at home, you can definitely judge it a little bit more, okay? And today's price for all of the items, the ground beef and all of our cans right here was $13.85. Okay? So these are quick, simple, and cost-effective meals, okay? As we go through, I'm gonna go ahead and start putting them in so they can start warming up while I talk to you guys. If you were here a few weeks ago when I was here, we talked about the nutrition label, right? The downside to these meals is they're coming out of a can, okay? Which means we're gonna have a little bit of a higher sodium content in them. However, the difference of just picking up something like this chili with beans and eating it versus what we're gonna do today is we're adding in more protein and we're adding in more fiber by adding in beans and adding in the tomatoes.
The purpose of today is for me to talk about resistance training. Has everybody ever done that before? Most of y'all probably have. Do y'all know why it's so important though? What if I told you that it's gonna help you move better, longer? What if I told you that resistance training could actually even slow down aging to a degree? Anybody ever heard that before? Yep.
Thank you, thank you, thank you. I was a little nervous, because you know men don't generally come out, but I appreciate y'all so much. And hopefully, if we decide to do this again next year, we'll get more of you guys